Hi, I'm Morgan Osborne. I'm an occupational therapy student at Chatham University. So your doctor ordered an occupational therapy evaluation. Are you aware of what occupational therapy is?
Yes, I am.
Okay. So first off, I'm gonna start. Oop! Fall off the seat. I'm gonna start off by asking you a few questions. Can you tell me your name?
Chris.
Okay, Chris. Can you tell me the date?
It is December 5th, 2019.
Do you know the time?
Is it like 12:15?
Yeah. And then, can you tell me why you're here?
I'm having a lot of weakness in my lower body, and I'm feeling dizzy a lot when I bend over and do things.
Okay.
And my hands I have trouble grabbing
Okay.
things.
And can you tell me where you are?
Chatham Hospital.
Okay. Good. So first off, I'm just going to review your chart with you. So it says here that your precautions are aspiration, and you're on a mechanical soft diet. Is that right?
Mm-hmm.
Okay. So then you said that you are 54 years old, and you're here for leg weakness, occasional dizziness, and shortness of breath while bending over. And you're a little, like, clumsy, kind of, with your hands?
Yeah, I have trouble grabbing stuff and using my fingers. My wrists kind of hurt. No. They're, stiff.
Oh, that's okay.
Yeah.
Okay. And then it says your past medical history here. You have hypertension, sleep apnea, and diabetes, type 2.
Mm-hmm.
Okay, so you use insulin?
Yes.
Okay. And then you had gallbladder surgery and a tonsillectomy?
Mm-hmm.
So we're first just going to start off by talking about your social history. So it says here that you live with your spouse.
Yes.
Can you explain where you live for me? Is it a house? Is it an
I live
apartment?
in a trailer, and there's a two steps to get in to the...
Okay. Do you have any problems with those 2 steps at all?
Not really, but a little bit. But since it's just 2, I can kind of make my way up. But
Okay. Do you think that you do that on your own? Do you have help at all?
sometimes my husband will kind of hold my hand and give me a little boost to get up. But I can kind of do it.
Okay. And then, can you explain to me what your bathroom looks like? Do you have a tub, or do you have a shower, like walk-in?
It's a tub shower, so I have to step in.
Okay. And then, so you live with your spouse. Are they home most of the time, or?
They work a lot, and they're gone most of the day.
Okay. And then it says here that you're a teacher.
Mm-hmm.
So before coming here, would you say that you did a lot of things independently? Did you have any problems with anything before that?
I did mostly everything independently.
Okay,
by
great.
myself. Yeah.
Great. Okay, and then do you use any devices at all to walk or no?
No, I don't.
And then going back to your spouse working, are they home at night or?
They get home around 6 o'clock.
Okay, so then how long are you usually home alone for between your job and then when they get home?
When I get home from work.
Yeah.
So 4 to 6, 2.5-ish hours.
Okay. Okay. So do you have any pain at all?
No.
No. Okay, so what I'm going to have you do is I'm just going to give you your chart here, and then can you read the top information for me?
Yes. Patient is a 54-year-old admitted to emergency room with unexplained leg weakness, occasional dizziness, and shortness of breath when bending over. Clumsiness in hands over the last 3 days.
Great, thanks. So you have really good near vision. Next, we're going to check your far vision. So I'm going to have you stand up. Are you going to have that? Okay, perfect.
Turn this way.
Yeah?
Okay.
Okay, so All right, can you read this sign on the wall for me?
It seems like such a simple thing, but every time you move the mouse on your hand a certain way, the pain is so sharp it forces you to stop being the productive, hard-working.
Great. Thanks.
Can I sit back down?
Yep, you can sit back down.
Okay.
You need some help? Okay. Alright, good job. Oh, let me just move your phone out of the way for you. I'm going to put it over here just if you can remind me after the evaluation is over to go and get that for you. Okay. So next, do you wear any glasses at all? I should have asked that
No, I
beforehand.
don't.
Okay. And then another thing I'm going to do is, alright. Can you see what's on your medical chart? You see what's on top of it?
Not,
Or is it anything near it?
not really. It looks like there's like a bump on it, but I can't.
Or you could feel it if you need to.
Like right here, there's like a bump.
Okay. So it seems like you're having a little bit of contrast issues. We'll definitely incorporate that into your OT sessions. Next, I'm going to do a few movements, and I just want you to try to do them the best you can. Follow along with me, okay? Can you look up to the ceiling? Can you look down to the floor? Can you shake your head no, or look both ways as you're crossing the street? Great. Can you shrug your shoulders? Good. Can you show me how you put on a necklace? Can you show me how you put on a bra? Great. Can you, with your thumbs up, make a rainbow? Or like you're going to do snow angels because it was snowing earlier. Back down. Can you put your arms out front? Can you flip them over? Do the Macarena, just kidding. Can you bring them back? Can you spread your fingers out? Can you put them together? Can you make a fist? Okay, and then rev your engine. No. Okay. Can you go inward? Can you go outward? Okay. And then I'm going to ask you to stand up again. Okay. And then can you go on your tippy toes for me? Great. Can you march in place?
This makes me a little tired, though.
That's a little tiring.
Yeah.
Okay. So you can sit back down then. Great. And then, this chair's a little too high. Can you inward? Can you swipe those crumbs outwards? Great. Can you look under both of your shoes? See if you stepped in anything. Alright, great. So it seems like you're having a little bit of problems with your wrist. Okay, so what I'm going to have you do is come off of the table and then just sit in that chair so you can swing your leg over. Sit down. Okay, great. So I'm going to have you put your arm on the table and then I'm going to have you bring your wrist upwards and resist the pressure that I apply, okay? Ready? Bring it up. 1, 2, 3, 4, 5. Great. And then can you wrist forward? And then same thing. You're still going to resist the pressure, okay? Up. 1, 2. Okay. And then we're going to do the other arm. Okay. Ready? 1, 2, 3. Okay. Next side. 1, 2, 3. Okay. Great. So you can actually stand up and then get back up on the table. Sorry to keep moving. Great. Okay, so next I'm just going to ask you a few questions about some of your daily activities. So how well do you think that you perform like eating activities? Do you think you do it independently or do you have some trouble?
I have a little bit of trouble. I can do it at first for a little bit, but after a while I start to lose like my grip on the fork and it falls out of my hand.
Okay. How satisfied are you with your performance right
Not very satisfied.
now? Okay. And then how important is that to you?
Pretty important. I like food.
Me too. Okay. So would you say that you did that? You do eating, like you do most of it yourself?
Yeah, most of it, and then towards the end, sometimes I get my husband helps me a little bit.
Okay. How do you feel like you do dressing? Getting yourself dressed in the morning or maybe at night?
It takes me a long time. I have to keep taking breaks to like sit down, or like when I bend over and I get dizzy, so I have to like stay seated up for a little bit till it goes away.
Okay. And then how do you think you perform that now?
Not very good compared to how I used to.
And then how satisfied are you with that?
Not very good.
Okay. And then what about like hygiene tests, like taking a shower or maybe washing your face, brushing your teeth?
I get kind of tired standing in the shower for too long, so sometimes I sit down in the shower.
Okay.
The brushing my teeth and hair is okay, but then sometimes I drop my toothbrush and drop my hairbrush.
Okay. And then, do you do laundry at home?
Mm-hmm.
Okay. So how well do you think you can do laundry?
When the basket's really heavy, I can't carry the basket, and then with bending over to get clothes and put them in the washing machine, I get really dizzy.
Okay. And then, since you are diabetic, are you taking your insulin?
I try to, but I have trouble finding it sometimes.
Okay.
I just can't
You can't find
see
it.
where, like I always put it in the same spot, but I can't.
You can't see it.
Yeah.
Is it like on the counter or in the fridge?
It's on our kitchen counter.
Okay. What color is your countertop?
It's like a creamish white color.
Okay. And then do you know what color the box is? Can you remember?
I think it's normally in like a white cardboard box.
Okay. So next, I'm gonna write out some few goals that I think would be beneficial for you for occupational therapy. Since you are having that weakness in your hand and having trouble with gripping, I think it would be beneficial to do some activities with eating and using adaptive equipment. So that just means like maybe different utensils that will be easier for you to hold and for you to be successful with that. And we're going to work on addressing your leg weakness and shortness of breath. We can do that by working on your endurance while maybe doing your laundry, since that is an important activity to you.
Mm-hmm.
And then next, you're having a little problem with your contrast. It's for your vision, so and it's really affecting the way you can take your insulin because you can't see the box on your white countertop.
Mm-hmm.
So we're going to do some activities with that to make sure that you're able to do that successfully. And then while you're here, I'm going to tell your nurse for your eating, when it's mealtime, she's going to bring out your adaptive equipment so that you don't have to use the other equipment, and we'll get that rolling. Does that sound good? Great. And then I'm going to suggest for you to get a wheelchair for the time being, and so that could work on your endurance and maybe help you fatigue less.
Okay.
And then we'll work on making sure that you don't need that, or if you need to continue using it, that's also fine. And then I'm also going to refer you to your eye doctor just to keep working on that contrast, and then they can do further testing for that.
Okay.
And then I would suggest that when you're discharged, you continue with outpatient occupational therapy because it can be beneficial to keep working on these skills and to get you back to doing things that you need to do and what you would like to do. How does that sound?
That's good.
And then just for some safety purposes, so say there was a fire at your apartment or your home, do you think that you would be able to know what to do to get out safely?
Yeah, I have my cell phone on me so I can call 911 to get the fire department, and then the two-step entry is doable, so I could make my way outside.
Okay, great. And then just something that I forgot to go back to, I'm going to give you 3 words, and I'm going to just ask you to remember them and say them back to me. So it's going to be cat, ball, and screen. Okay. Can you say those back to me?
Cat, ball, screen.
Great. So that's everything that I have, but you forgot to mention your cell phone.
Thank you, I forgot about that.
Okay, and then just another thing, just to get you working on that hand weakness, if you're just laying in bed and watching TV while you're here, I'm going to give you a stress ball, and I'm just going to ask you to squeeze the ball 10 times on each hand, maybe like once a day or twice a day.
Okay.
All right, I'll see you in a couple days.
Thank you.
You're welcome.